I'm Aditya Nair, and my today's topic is investigations of stroke. So, what is stroke? Stroke or cerebrovascular accident is the sudden loss of neurological function caused by an interruption of blood flow to brain. There are two types of stroke: ischemic stroke and hemorrhagic stroke. So, let's start with the clinical assessment, which has three components: the history, physical examination, test and measures. History involves past history, medical history, personal history. There are many more histories. Past history means if there is any type of, if the patient has a familial, if the person has anyone else with the stroke or not. Medical history involves if the patient has any other diseases like diabetes, which can worsen stroke. Personal history involves if the person has any type of drinking or smoking habit, which has caused stroke. Physical examination, which involves vital signs like heart rate, blood pressure measurement, then function of cerebral hemisphere, cranial nerve examination, etc. Tests and measures include NIHSS, which is National Institute of Health Stroke Scale, which is used for the evaluation of the stroke patient. Next is neuroimaging. So, what all diagnostic tests are seen in neuroimaging? We will just see. Computer tomography, which is the most commonly used and readily available neuroimaging technique. CT allows the identification of large arteries, veins, and venous sinuses. In acute phase, CT scans are negative. So, usually in acute phases, the CT scans are usually used for thrombosis, for the tumors or abscesses, and usually CT scans are used for hemorrhagic stroke. Okay. Second is the MRI, magnetic resonance imaging, which is evolved to become the first line imaging in some stroke center. MRI measures nuclear particles as they interact with a powerful magnetic field. This shows greater resolution images than CT. So MRI is usually used in the sectors where CT is not available. And MRI can be used in acute phases, which is more preferred than the CTs. Next is laboratory investigations, which involves the biomarker assays. Biomarker assays include cardiac troponin levels, which can you can evaluate it for myocardial injury, which has if it has led to stroke or not. Hematological studies include CBC, complete blood count, platelet levels, which can suggest any type of infection. Next is serum electrolyte levels, which evaluates the sodium and potassium levels, which can interrupt the management of the stroke. Renal function test assesses the function of kidneys. Liver function test for the assessment of the function of the liver. And these two can, if there is any problem in the liver or the kidneys, it can lead to the disturbance in the management of stroke, or it can worsen the stroke. Lipid profile is used for evaluation of the cholesterol levels, which is directly related to the risk factor of stroke, that is atherosclerosis. ECG. ECG is electrocardiogram, which finds problems related to heart that may have led to stroke. This can help identify previous heart attack or arterial fibrillation. This is the example of that. Vascular studies include Doppler ultrasound. It is a non-invasive technique wherein sound waves are sent into the body. Echoes bounce off moving blood and artery and are formed into an image. Carotid Doppler is used for carotid arteries. So these Doppler ultrasounds will measure the velocity of the blood flowing inside that arteries, and will also understand if there is any type of obstruction or not. This is an example of transcranial Doppler. Digital subtraction angiography, this is not used these days because it is a non-invasive technique, as well as it can lead to stroke. So DSA is also an X-ray of the carotid artery with less dye used. So contrast dye is inserted inside the blood vessels for and image is taken to see the blood vessels. You can see here. Magnetic resonance angiography is a type of magnetic resonance image that uses special software to create an image of arteries in the brain. It is used to identify vascular abnormalities and alterations in the blood flow as a result of thrombosis or embolus. So this has the same function as the DSA, but this is a non-invasive technique and it is mostly used. You can see the image. Last, the other investigations include the lumbar puncture or the spinal tap. So, lumbar puncture or spinal tap is an invasive technique, and this is used when the doctor is suspicious, even though the images appear normal, images can appear normal, and the doctor is still suspicious of any type of hemorrhagic stroke. So, what happens is a needle is inserted into the spine, and cerebrospinal fluid is taken from that spine and is tested for substances that come from damaged blood cells. So that conclusion is the healthcare provider will order tests to rule out other health problems with similar signs or symptoms. The faster you diagnose the condition, the good will be the prognosis. So the earlier the diagnosis, the better the prognosis. So thank you. And the reference is taken from Physical Rehabilitation by O'Sullivan, and this is a website. Thank you. Have a nice day.